Okay, today we are going to demonstrate the insertion of a nasogastric tube. First thing we are going to do is prepare our equipment at bedside, which we have pre-done. The nurse is going to identify herself.
I'm Tamara. I'm going to be your nurse today.
And identify her patient.
And can you tell me what your name and date of birth is?
My name's Mr. Jones, 31053.
All right, Mr. Jones.
The nurse is then going to tell the patient why he is having the procedure and what procedure we are going to be doing.
We are going to be inserting a tube through the nose down into the stomach for feeding purposes.
There are other reasons why we will insert an NG tube, such as a bowel obstruction, gastric decompression, tube feedings, such as for this demonstration, administration of contrast, and relief of symptoms. First, the nurse is going to inspect the nares of the patient, instructing him to relax and breathe
Lay
normally
your head back and breathe normal.
while occluding one nair.
I'm just going to look up here.
The same step will be provided for the other nair. She is checking for which nair has the greatest airflow, and that nair will be the side that we use to insert the tube. All right, the next step is to don your gloves and unwrap and uncoil your tube. The next step is going to acclaim the patient's next measurements, which is the nose to the earlobe to the xiphoid process. You can either tape this end here, but we are going to use a marker to show our stopping point. All right. While maintaining clean aseptic technique, you're going to lubricate the tube 3 to 4 inches from the end with water-soluble lubricant. And for these purposes, we are going to use plain water because our mannequins do not do well with the lubricant. You're going to instruct the patient to give a signal that he may need to pause.
If you have any trouble, just raise your hand and we'll stop.
Position the patient in a high Fowler's position. Instruct the client to relax his head and neck against the pillow. Insert the tube gently, slowly through the nair, while pointing it backward and downward. With tube just above the oral pharynx, instruct client to flex head forward, taking a few sips of water, if not contraindicated, and swallow, while advancing the tube 1 to 2 inches as the client is swallowing. Continue to advance the tube with each swallow until tape or marker is reached, at which time you will temporarily anchor the tube to the client's cheek. You're going to check for placement of the tube by asking the client to talk.
Tell me your name and date of birth.
Mr. Jones, 31053.
Inspecting the posterior pharynx for presence of a coiled tube. If there's no presence of a coiled tube, you can go ahead and attach a 60 cc syringe to the end of the tube and aspirate gently to obtain gastric contents. You will then need to check the pH of the contents using the pH paper provided. You will need to obtain an x-ray per the physician's orders before initial internal feeding to check for proper placement. For this purpose, we've had our x-ray, placement's good. Then we're going to anchor to the client's nose and to the cheek.
And to the cheek.
Attach the feeding per physician's orders. Place client in a position of comfort with head of bed elevated at least 30 degrees. Provide near and mouth care as needed. At this time, you can remove your gloves and perform hand hygiene and remove all equipment from the room. In periodic intervals, the nurse will need to assess the color, consistency of aspirate, assess the respiratory status, including lung sounds, the condition of nares and mucous membranes, assess bowel sounds, and palpate the abdomen. Okay, that concludes our demonstration for nasogastric tube insertion. A few nursing considerations are going to be, you want to make sure that you are marking the length of your tube prior to insertion. That way you're not going too far or not far enough. You always want to check placement of tube. A quick check you can do is checking the gastric contents to check for pH. Gastric contents are acidic, so the lower the number, the higher the acidity. You also need to make sure that you are verifying placement by obtaining an x-ray on it before any initial feedings. Make sure to anchor the tube to the face so that it does not come dislodged. And always, always, always maintain the head of bed at least 30 degrees. And we always want to document. You need to document why the procedure was necessary, the tube length and size and time it was inserted, which nair was used, patient's tolerance to the procedure, which Mr. Jones did wonderfully, and confirmation of tube placement, which would be the reading of your x-ray. This concludes our demo.